Here is your question. Very little, very brief. You have to just keep this in your mind. I forgot to add more information in it, but all right, we'll just assume that everything is mentioned. All right, so if you have read and understood, considering a procedural skill station, kindly please begin.
Hello, I'm Dr. Faizan. I'm one of the surgical candidates. May I confirm your name and age, please?
Yes, I'm Samantha, 28 years old.
So, Ms. Samantha, I'm going to today I'll be stitching the wound over your right thigh. This will involve me stitching the wound under local anesthesia. You won't be having any pain during the procedure. If you have any pain during the procedure, you can tell me and I'll stop and I'll give you more anesthesia. And there can be complications such as there can be bleeding from the wound, and there can be there can be infection of the wound. So, is that okay with you?
Yes.
Okay. So, is there written consent available?
Yes.
Okay.
Then what more would you ask before beginning?
Yes, I'll check the patient identity by checking the name on the bracelet, and I will check the WHO checklist for the uh, site and the site of the injury suturing procedure. Then I will ask the patient whether she has any lignocaine allergy or any other allergies.
Very good. Yes. One more question.
Whether she's on any blood thinners.
Yes. One more.
And I will also like to ask the examiner if there is an X-ray available to see for any foreign body.
Yes.
And also I will ask the patient for the tetanus.
Very good. Excellent. Yes. Okay. What equipment would you be needing?
I will, if there is an assistant available, I'll ask him to prepare equipment.
Yes, I'll be helping you.
Okay, I'll be needing a gown, sterile gloves, skin preparation solution.
Yes.
Then I will be needing a 10 ml syringe and 1% lignocaine solution.
Yes.
And I will be needing a 21 gauge needle and a 25 gauge needle. And I will be needing a tooth forceps and a needle holder and a suture material, a non-absorbable suture material.
What
and
type
also,
of dressing?
Simple adherent dressing.
Yes, very good.
And also scissors.
Yes.
Yeah, that's all.
Yes. Continue. Prepare your patient.
Okay. So, Mrs. Samantha, so we'll be starting the procedure. Firstly, I'll be giving you the local anesthesia. So before giving the anesthesia, I would like to check the expiry date. And yeah, I'll check the expiry date of the local anesthetic. And I'll tell the patient that she will be feeling a small prick sensation before I give the anesthesia. So I will start anesthesia around the wound by infiltration. And I'll withdraw my plunger to see if I'm in a blood vessel. If not, I will inject the solution. Then after anesthetizing, I want to wait for around 5 minutes for the anesthetic drug to act. Then I will discard the needle.
How much local anesthetic would you give to the patient to anesthetize? Yes.
Maximum will be 3 mg per kg if it is plain lignocaine and 7 mg per kg if it is with adrenaline. So I'll
assuming the wound is on the thigh, yes.
around the thigh length.
Average weight and height of the patient, yes.
Yes, ma'am. I'll infiltrate around the wound, around 5 to 10 ml would be enough, I think, ma'am.
Okay, yes. How long would you wait?
I will wait for 5 minutes, at
Yes.
least 5 minutes. Then I will start my suturing. If the wound is a clean wound, there won't be any need for debridement, and I'll hold the suture needle at the junction of outer 2/3 and inner 1/3 with the tip of my
Yes.
needle holder in one
Yes.
hand and tips with other hand, and I will put simple interrupted sutures.
Yes.
And after suturing, I will discard my sharps into the sharps bin, and
How
I
would you
will
make sure if the anesthetic has already taken its effect
before
before
suturing, I
you'll
will
suturing? Yes.
check for the anesthesia effect by holding the skin, pinching the skin with the
Yes.
forceps,
Yes.
and I will start suturing. Then
Yes.
after suturing, I will apply a simple adherent dressing, and I will discard the sharps into the sharps bin. Then I would explain the patient that he will be sent home with analgesics and antibiotics as per the NHS protocol. If it is if the patient presents before 6 hours, then a single dose of antibiotic will be enough. Otherwise,
According to the NHS guidelines.
yes,
Yeah.
further doses will be needed. Then I will explain the patient the warning signs. If you have any pain, redness, or bleeding from your wound, or any foul smell or fever, then please you can contact your general practitioner. And I'll also explain him that she has to go to the general practitioner for suture removal, which will be around 10 to 14 days. After 10 to 14 days, then I would like to document. I will ask the examiner for documentation of the procedure.
All right. Just suppose this wound. You've already told me how many. Which suture material would you use if the wound was on the thigh?
I would use 10 or 20 non-absorbable nylon can be used, ma'am.
Okay. What would you advise to the patient? When should the sutures be removed?
The sutures will be removed after around 10 to 12 days, ma'am.
Yeah, 7 to 10. Okay. Can you please tell me? Right. If you have to give antibiotics, a single dose of which antibiotic would you recommend according to your NHS guidelines or trust policy?
A broad spectrum antibiotics such as
Yes.
amoxicillin and potassium clavulinate.
All right, good. Can you tell me, depending upon if it was on thigh, you've decided to use lidocaine with adrenaline, how much would you give and what would be their mechanism of action?
Lignocaine with adrenaline, maximum dose can be 7 mg per kg.
Yes.
And the mechanism of action is it blocks the sodium channels, preventing the depolarization of the nerve endings.
Okay, good. Which leads to?
Which leads to analgesia and anesthesia. Which leads to there is no action potential generation and
Yes.
failure of transmission of signals.
Yes.
No.
Which prevents the transmission of the pain signals or, yeah. All right. So 1 second left. Good. Good. You covered almost everything. What was not covered, I asked you. So excellent.
Thank you.
Yes. When you'll be talking to the examiner, or if there is a helper or maybe assistant would also be the examiner, they will also be observing that while you're talking and you're communicating, and at the same time you're suturing as well.
Okay.
The wound. So everything will be carried out at the same time and in the 8 minutes. So good.
Ma'am,
Yes.
ma'am, I have a doubt, ma'am. In such a station, if there is no patient and if there is only the maquette with the wound, then how do we start, ma'am? how do we start with the examiner?
You'll pretend that it's a patient. That's what I have.
Okay, so we have to do
received
the
feed-
thing.
Yes, you'll check with the
Okay.
band. There'll be band there, patient name or identity would be there. So you'll confirm the identity. And you'll start pretending that, okay, who is the assistant here? You'll confirm, examiner will volunteer itself. Then you can ask, okay, if the patient has been, if there is consent, you'll get the confirmation that consent has been taken. You will confirm about the tetanus status of the patient. You'll confirm if the patient has any allergies or not. So just pretend that even if it's a model or whatever that is, it's a patient, and you're asking your assistant if it has been done. Play as a boss
Okay.
and ask them, give them orders, and that's how you have to play the role. And suturing, you know, how much distance you'll keep from one suture to the other, because it's a wound, so you won't have your sutures close together. So there's 0.5 distance you have to keep between the suture. Good.
Okay.